Welcome to the pSCANNER Stakeholder Research Prioritization Panel. In this module, we'll provide an introduction to the pSCANNER network and the role of the Stakeholder Research Prioritization Panel in setting top priorities for research. This project is called pSCANNER, which stands for Patient-Centered SCAlable National Network for Effectiveness Research. Our mission at pSCANNER is to be a stakeholder-governed, distributed clinical data network that aims to make health data and newly researched scientific evidence accessible to and functional for patients, clinicians, and other stakeholders, so that together they may use the information to make more informed health decisions. Stakeholders in pSCANNER include those people whose views and opinions are important to the network. We try to involve patients, healthcare professionals, and researchers as the key stakeholder groups in making decisions about our work. A distributed clinical data network is a collaboration of healthcare organizations in different locations that use technology to provide access to health data safely and securely for research. We'll be providing more information on this idea later in the module. We face many challenges in conducting excellent research to improve health. pSCANNER will address 3 of these challenges head-on, but first, some history. In the past, research has focused on the priorities of scientists and clinicians, which may be very different from those of patients, family members, and caregivers. Uncertainty as to what's best for patients under particular circumstances is one reason why healthcare often falls short in terms of quality. Specifically, uncertainty as to the benefits and risks of treatments and the effectiveness of alternative treatments can and does result in poor care and poor outcomes. In addition, health research often required large numbers of study participants, but many individual healthcare organizations didn't have enough patients with a given condition. Traditional approaches to data sharing didn't make it easy for researchers and clinicians to access, collect, and meaningfully analyze patient records in a timely manner. Moreover, evidence from health research could take years to transition into practice because of the challenges in communicating and disseminating new and better practices. For example, we must first show that a new medication is safe enough in humans. Then the right dose has to be established. Finally, the medication should be tried on a large enough group to determine what the side effects might be and how serious they are. These steps take years to accomplish. One way is to involve interested parties or stakeholders in decisions about research. Our first challenge. With pSCANNER, we invite stakeholders' participation in all aspects of our work. Among the stakeholders we engage are patients with the health condition to be researched, patient advocates, and clinicians who treat the patients, such as physicians, nurses, dietitians, social workers, and, of course, researchers. We involve these stakeholders in governance, which is the setting of policies and decisions about how we run pSCANNER. We also involve stakeholders in developing materials for education and communication about our work. And finally, we involve stakeholders in setting research priorities and designing the research. This last activity is the role of the Stakeholder Research Prioritization Panel. Now, here's where you come in. As a member of this expert panel, you'll be helping us to decide where to focus the research we hope to conduct through pSCANNER in the future. We'll focus on 3 health conditions for our research: weight management obesity, congestive heart failure, and Kawasaki disease. pSCANNER's second challenge: bring together data on large numbers of patients to conduct timely research. pSCANNER is finding ways to improve access to data that'll help us study important, relevant research questions. Now, for instance, in order to understand which of 2 heart disease medications is a more effective treatment for certain patients, we may need thousands of patients to participate. There may not be enough participants at one given site, so we need multiple sites to collaborate. In pSCANNER, a number of medical centers and clinics have already agreed to partner. These include the University of California Health Sciences campuses, the University of Southern California and affiliated clinics, and the Veterans Administration Health System. Together, these sites care for 21 million patients. Others will join in the future. But in order to recruit a large number of patients and obtain their permission to use data, we also need a way to keep patients' information private and secure. So here's how we'll do this as we recruit participants. First, each clinical site identifies patients who might be eligible for a particular study. Those are the candidates. The site reaches out to the patients using a patient survey and then asks if they'd like to enroll. Those who agree become part of a cohort, which is simply a group of participants all in the same study. But we also want to maintain the privacy of those patients, so the identifying information is kept securely at the site. The ID information is stripped before the rest of the survey data is sent to the pSCANNER central database. Different sites will have different numbers of patients who participate in any given study. Our goal is to create a large cohort of patients who are willing to be involved in research for future studies. From all sites combined, we'd like to recruit a total of 10,000 people for the weight management and obesity cohort, 10,000 people for the congestive heart failure cohort, and 1,000 people for the Kawasaki disease cohort. But to conduct large-scale scientific research, or big science, we need to make it easy for researchers to access, collect, and analyze all patient records in a timely and secure manner. pSCANNER addresses this, the third challenge, by using new technology. The pSCANNER central hub assures that patient information is handled in a trustworthy way and makes sure that the methods we use for any research design are consistent and accurate across all the sites. All the sites receive messages from the pSCANNER hub. Messages from the hub are sent out to coordinate the data flow, the analysis, and the results report. And the built-in security between each site and the hub protects the privacy of patients. We want to assure patients that we'll do our utmost to preserve and protect the privacy of their health information. Okay, privacy may mean different things to different people. Federal regulations for health information have very specific definitions about privacy and what health organizations are allowed to share. For example, under federal law, healthcare organizations can't share your name, address, photo, phone number, or even dates you were seen in a data set used for research without your consent. At times, researchers may need to know some of the identifying information about patients in the data set. Now, in the past, each site had to collect data, create a data set, including all the necessary details and ID information, and then send it to a central location. Then researchers at the central location would combine all the data and do a statistical analysis. But you can imagine how there might be some risk of exposing that data during the transmission, and some of it might even be lost or corrupted. pSCANNER investigators have spent a lot of time understanding patient preferences for privacy. They wanted to develop privacy protections that were even better than the federal regulations, but still allowed researchers to make needed scientific discoveries. With the new pSCANNER way using the latest technology, we can make sure that data doesn't have to leave the local site. Amazing! So here's how it works. pSCANNER sends a message, a little piece of software, to each site with the research question, the same instructions for selecting patients, running statistics, and reporting results. Now each site just has to send back the results, not the whole data set. That way pSCANNER can do sophisticated research studies, but your data never leaves your doctor's office or hospital without your approval. Using our unique approach to privacy-preserving big science, we're contributing to pCoreNet, which seeks to improve the nation's capacity to conduct clinical research by creating a large, highly representative, national patient-centered network that supports more efficient clinical trials and observational studies. This work is funded by the Patient-Centered Outcomes Research Institute. Please view the other educational modules we've provided for the members of the Stakeholder Research Prioritization Panel. Thank you for joining us on this adventure to improve the efficiency and relevance of research that we hope will lead to better health for all patients.